record on mic. Okay, so Zoom just let us know that we are being recorded. If for some reason you do not want to be on video, please go ahead and turn your video off. If for some reason you do not want your name to be shared, you can actually change your name in the Zoom settings, but hopefully it will work for all of us to be here and share this together. So again, my name is Amy Hartl. I am the new Vice President of the Board of Directors of the Breast Cancer Network of Western New York. I'm also a breast cancer survivor. I went through it in 2017. I grew up high risk. I'm BRCA1 positive with a long family history. So I have been around breast cancer for a very, very, very long time, most of my life in one form or another. I'm also a local oncology massage therapist and manual lymphatic drainage therapist. And I'm honored to get to know Donna, and I was able to sit in on her presentation that she did that was sponsored by Winsong a couple of weeks ago. And so I know that we're going to have a fantastic session tonight. She's going to share some really valuable information with us. I'm going to ask you, if you have a question, you can put it in the chat. We probably will save Q&A until the end so that we can let Donna go through the information she's here to share, and then we'll do Q&A at the end. If you are afraid you will forget your question, feel free to go ahead and put it in the chat, and then we'll get to it at the end of the presentation. Okay, so I think that's all the housekeeping, and I'm going to go ahead and very happily introduce Dr. Donna Gulick. Did I say that right, Donna? Is it Gulick? Okay. Dr. Donna Gulick, who co-founded Orthosports with her business partner in 1989. She graduated from Daemen College in Amherst, New York in 1984. She returned to Daemen and completed her Doctorate of Physical Therapy in 2005. Donna completed training with the Norton School of Lymphedema Management in 2009 and is a Certified Lymphedema Therapist, sometimes called a CLT. Her specialties include the following: manual therapy, orthopedics, lymphedema management, and cancer rehabilitation. She is a member of the American Physical Therapy Association and the National Lymphedema Network. And I am going to let Donna take it away. And so excited to be here with all of you tonight. Thank you, Donna.
All right. Thank you very much. Amy, there's just one more housekeeping thing you need to do. You need to make me a co-host so I can share my screen.
That I will do that. Thank you. And I have to figure out how to do that. Okay, one second.
Participants.
Okay. Go to participants.
You'll find my name on there.
And I click more and I make host.
Yes, or co-host, whichever.
Okay, let me see if it gives me that option. It looks like it just says make host, so I'm going to bump it over to you.
Okay, sounds
all
great.
Right. There we go.
So now I should be able to share my screen. So we will do that. And there we go. All right, so thank you very much for that wonderful introduction, Amy. I really appreciate the opportunity to be here with you all once again tonight. As I mentioned 2 weeks ago when I had the chance to speak, breast cancer population is a very special group to me. I really, really enjoy this part of my practice. And it's always great to be able to connect with some new faces, as well as see some familiar faces on this meeting structure, as well as to just have the opportunity to share some of the things that I have learned over time. And hopefully you'll find it helpful as you go through your recovery and your journey. So tonight we're going to talk a little bit about breast cancer related lymphedema along with exercise and the benefit of exercise. So our objectives for this evening is just to spend a little bit of time reviewing what the diagnosis of lymphedema actually means and what the incidence of lymphedema is in the case of breast cancer survivors. We want to talk a little bit about who is at risk. We also want to discover some of the myths and truths about exercise and lymphedema. We're going to learn some of the benefits of exercise And I also want you to understand what the types of and quantity of exercises are that can be of benefit to you. So first of all, let's talk about that diagnosis. Lymphedema is an accumulation of protein-rich fluid due to the mechanical insufficiency of the lymphatic system. So that's a lot of words that mean what? What that means is there's fluid in an extremity, generally an extremity, can be in the trunk, can be elsewhere, but it's usually in the extremity where the cancer occurred. And it's not just fluid, there's protein in that fluid. And that's what the problem is. If it were just fluid, we could get rid of it as simply as taking a water pill. But since it's not just fluid, it's a problem. It can cause tissue changes and lead to other issues. And it's a result of some kind of injury, some damage to your lymphatic system. Either lymph nodes have been removed, or something is blocking the flow of that fluid, or radiation can also lead to some kind of damage. So that's where lymphedema comes from when it comes to a breast cancer related diagnosis and what it actually means when you're diagnosed with it. The incidence of breast cancer related lymphedema, to the best of our ability at this point in time, these are some pretty current numbers. Approximately 7% of the folks that will have had just a sentinel lymph node biopsy will develop lymphedema at some point in time. And approximately 15 to 20% of those who have had all of the lymph nodes removed from their armpit area have the potential to develop lymphedema. So the numbers with sentinel lymph node are very small, and we're grateful for that, but there's still a pretty high percentage if you have to have an axillary lymph node biopsy done. So we want to do as much as we can to help prevent the occurrence. And one of those ways is through exercise. So what are a couple of the myths that we know about lymphedema and breast cancer, or any kind of cancer for that matter? Once upon a time, we were told that persons who are at risk or who have lymphedema shouldn't do any kind of heavy lifting or any kind of exercise at all with their involved extremity. Stay away from it, don't do it. Oh my gosh, it's gonna be the end of the world. And also vigorous exercise will cause lymphedema and should be avoided. So repetitive use type activities, if you were to go out and rake the leaves or paint your house or do even a lot of dusting or window washing, it was thought that you might develop lymphedema as a direct result of those activities. Now, where did those myths come from? I don't really know. I'll be honest with you. The only thing that I can conclude, and based on some of the information, was that, way back when, before they were doing lymph node, just the sentinel lymph node biopsy, a lot of folks developed lymphedema, and it seemed to be correlated with any kind of activity. So they were just told, don't use that arm or don't use that leg. And we also know that activity also leads to some fluid going into your extremities because your organs need to cool down a little bit. So it's natural to shift some blood and fluids into the extremities to cool your organs down. So there was probably a prevailing thought process that, oh my goodness, these people are at risk. If we exercise, they're going to have more fluid in their extremity and therefore they're going to develop lymphedema. So let's just avoid it. We won't exercise at all and everything will work out fine. So what do we know that's actually a truth? Truths are now shown to be that inactivity and a sedentary lifestyle are actually risk factors for developing lymphedema. We know that the lymphatic system needs those muscles to pump in order to operate well, and exercise will help keep the system strong. If any of us in this group were to just go stand in a corner somewhere, our feet and ankles would swell up if you were standing there for a prolonged period of time. The effects of gravity and not using your muscles will cause fluid to accumulate in the lower part of your body and in your fingers and your hands. So we know that the muscle pump is crucial to keep the fluids flowing in our system, whether you're at risk for lymphedema or not. And we also know that physical activity can help you to maintain a healthy weight, and that is a risk factor for lymphedema. So we want you to maintain a healthy weight and be fit because we don't want you to have that risk involved. Now, how do we know these things? Well, some of you are probably very familiar with dragon boat racing. I know there's a great group here and a lot of strong women that are participating in this locally. How did that all come about? Well, there's a doctor by the name of Don McKenzie who heard this rumor, this myth, that people who had the potential for developing lymphedema shouldn't exercise. And he thought that was a bunch of bunk. So what did he do? He went out to prove that that was a bunch of bunk. And what he did was he recruited 23 breast cancer survivors to form a team back in 1996. They took measurements. He worked along with this woman, Susan Harris, who's a physical therapist. They took measurements before, during, and after the training that they participated with, and they didn't find any change in the size of the limbs. So this was a small study. The results were published in 2000. So it started making the medical community start to think a little bit more about, geez, maybe this guy is onto something. What are the odds that somebody can participate in something as rigorous as dragon boat training and not have any ill effects as a result of it? So we moved the calendar forward a few years, and we now have this woman, Katherine Schmitz, who heard about this dragon boat study and thought, that was a small study. Let's investigate this a little bit further. So she did a study that was published in 2006. She followed 45 participants over a 6-month period of time. And she determined that through that small study, that progressive upper body resistance training, so strength training, was perfectly safe. They had no ill effects as a result of doing that. This was followed by the PAL study, the Physical Activity and Lymphedema study, that was published in 2010. And this really, really, really turned the lymphedema world on its head, because it had a large enough group over a longer period of time that really showed the benefits of exercise. So that's kind of changed the thinking. Even in the certification programs that I attended, I was told to teach people to not do anything repetitive. They could exercise, but don't do it repetitively. Whereas this PAL study really changed that thought process. Katherine Schmitz went on after that to develop an exercise program that's called Strength After Breast Cancer, or Strength After Cancer. She's modified it to include people who had other forms of cancer as well. And this is a very detailed, very specific exercise program that is undertaken following a breast cancer diagnosis and treatment. It consists of a physical therapy evaluation where the therapist checks mobility and strength, and if there's any other issues to be addressed, they will take care of that. That's followed by a 1-hour educational session that's either in a group or one-on-one. And after that, they're giving 4 group sessions, or again, one sessions, where they go through the exercise routine and make sure that everybody is doing it safely. And then after the last one, they're discharged to just a home program where they're told how to progress that exercise routine and do it safely. I have taken the training for this. It's a great program. It's a great starting point, and it's very, very simple and very basic and very easy for people to understand how to progress without being fearful of causing any issues to themselves. So Katherine Schmitz has really, really done some great work. Then again, we're moving the clock forward a little bit more, and we're now in 2013. There was a study published in the Journal of Cancer Survivorship that again followed a large group of women, so 62 women over a 6-month period. They were broken up into 3 different groups. One was assigned a heavy weightlifting group, one was assigned into a light weightlifting group, and the third group was assigned no exercise, no lifting at all. Over that 6-month period of time, it was determined that there was absolutely no difference in the swelling of the extremity or any severity of symptoms between the 3 groups. And in fact, it was shown that there was an improved strength in both of the weightlifting groups, and not surprisingly, that there was no improvement in strength in the non-weightlifting group. They also experienced some things that they weren't necessarily looking for. They had a significant improvement in their pain levels, their general overall health, their mental health, which is an area that is not talked about nearly often enough, their social functioning and how comfortable and confident they felt out in public in those weightlifting groups. So this was a great advancement to show the benefit of exercise, and not only just in strength, but in also how a person goes out into the world and presents themselves. Last but not least, I won't bore you with any more studies after this, a 2015 study that reviewed a whole bunch of other studies that had been published to determine what the benefits were of exercise and at-risk people or people who already had lymphedema. It was determined these 4 different things that first, resistance exercise was safe and effective in women that already had lymphedema. Women with breast cancer related lymphedema could also exercise without fear of exacerbation of their symptoms. It was determined that it's safe for breast cancer survivors to perform both aerobic exercise and resistance exercise, both during and after treatment. So it didn't need to wait until they were done with chemotherapy and radiation and all the other treatments that come along with the diagnosis. They could participate in these things while they were actually undergoing treatment. And last but not least, it was determined that exercise can improve the range of motion and strength of the affected limbs, as well as improve the overall fitness and quality of life. So again, getting back to that oh so important area of quality of life measurements that oftentimes are ignored. You've survived your cancer, but you know the rest of it is just gravy. Well, we all know that that's not true. Surviving is one step in the battle. Getting back to living again is a whole nother battle. So why do we want you to exercise? As I've already mentioned, there's an overall reduction in symptoms both during and after treatment. When I have the opportunity to speak with folks before they undergo their surgeries, I always try to encourage them to get in the habit of starting an exercise routine that they can continue during their treatment. It's been documented over and over and over that folks who exercise, even while they're undergoing chemotherapy and feel like crap, that they feel better. The folks that exercise don't experience the symptoms that non-exercisers do while they're undergoing their treatment. And after treatment, it's important because again, we want you to make sure that you're maintaining that healthy weight and healthy activity level. We also know that exercise is beneficial for reducing the risk of a reoccurrence of your cancer. It's been determined very succinctly that folks who exercise and exercise regularly have a much lower chance of reoccurrence of breast cancer. And it also has been proven to show that there is a reduced risk of ever developing lymphedema if you exercise and maintain, again, that healthy lifestyle, that healthy weight, and keep the muscles moving and keep your mobility up. So those 3 things are the huge benefits of exercising after a breast cancer diagnosis. So what are we talking about when we're talking exercise? What does that really mean? If you're somebody who has never exercised, you don't know where to start. What does that entail? I've always been active my whole life, so exercise for me is very natural. But for people who have not exercised and have never participated, they don't know where to begin. Exercise can be as simple as going out and taking a walk. It also includes things like cleaning your house. I don't want to exercise cleaning my house, but some people find that that's a great joy, and I wouldn't deny that. But what the recommendations are, if you think about it this simply, and this is from the American College of Sports Medicine, these are recommendations for anybody. It's not just cancer survivors. It is all of us out here living our lives in the beautiful world that we live in. This is what is suggested for all adults, healthy or otherwise. They want us to be doing approximately 30 minutes of exercise, of moderately intense cardiovascular exercise. And that's things like biking, swimming, walking, elliptical work, those kind of things. 30 minutes a day, approximately 5 days a week. Okay. I usually tell people if they're doing moderate activity to think about 150 minutes a week. And that can be broken down into any kind of time frame. We know that, again, through some very recent research, that 30 minutes a day doesn't have to be all done at once. So if you don't think you have 30 minutes to spare, or you don't think that you can tolerate 30 minutes of continuous exercise, you can take a 10-minute walk in the morning, you can take a 10-minute walk at lunchtime, and you can take a 10-minute walk after dinner. And that total time is as beneficial as if you did it all at once. So don't think that you don't have time. It's available. If you're somebody who's a jogger or wants to do, again, some real aggressive elliptical work, or is a biker that does a lot of heavy duty biking, this is more intense cardiovascular exercise. And this is recommended 20 minutes a day, about 3 days a week. So depending on what your level of aerobic and cardiac conditioning activity is, you can determine if 30 minutes a day is appropriate or 20 minutes a day is appropriate. And last but not least, it's recommended for all of us that we do strength training, especially as women. As we get older, strength training is very, very important to maintain healthy bone density, as well as maintain mobility skills and keep our muscles from getting tight and tense. So we want you doing strength training twice a week, and that's 8 to 10 exercises, approximately 8 to 12 repetitions with each exercise, and again, twice a week. So again, we're going to go through a few very simple exercises at the end of this. So if you don't know something to do, we can give you some basic ideas to where to start. So again, that's for all of us. We definitely want anybody doing this level of exercise on a weekly basis. Something that you can do going back to that is, the portable exercise fitness devices that have become so popular, the FitBits and the Garmins and the things of that nature, can be extremely helpful to have you determine how active you really are. You can program them for how many steps a day you want to take. You can set a timer on them that tells you to get up every hour and take some steps. So there's lots of benefit to having one of those things that helps you remember whether or not you've been active enough during the course of the day. I have a Fitbit. Mine is rarely buzzes because I'm active all day long, but on weekends, every now and then it'll give me a nudge because I've been sitting in my recliner a little bit too long. And oh yeah, geez, I guess I have been sitting here too long. I better get up and move a little bit. So how do you know how to exercise safely? Here's some guidelines that we want to provide for you. First of all, you want to gradually build up your duration and your intensity, especially if you've never exercised or if it's been a very long time since you've exercised. So again, going back to that strength after breast cancer program, again, it starts very, very lightweight and increases by a pound a week if you're doing upper body exercises, as opposed to jumping major increments. So you can start by just moving your limbs without any kind of resistance and find a benefit from it. When you start walking, take some ideas to, let's see, today I'm going to walk down to the corner and turn around and come back, or I'm going to go 4 houses down and turn around and come back, and see how you feel after that. And if you feel fine with that, the next day you try to go down to the next house. It's recommended that you take frequent rest breaks, especially again, if you're just beginning exercise. You want to kind of be able to step back, see how you're feeling, see if you're thirsty. Are you perspiring significantly? Then you want to take in some fluids. Don't feel bad about having to sit and rest. And in particular, if you're somebody who's going through treatment, you're going to need to take some rest breaks. There's days that you're going to feel exhausted. So don't hesitate to take rest breaks as you're just getting into this exercise routine. For the folks who are at risk, if you know that you've had a total axillary node dissection, if all those lymph nodes are gone and you're at higher risk than somebody else, you want to keep tabs on how that side feels when you're exercising. So let's say you had breast cancer on your right side and it's your right arm that is at risk. Just kind of pay attention to how it's feeling. If you notice any change in how heavy it feels or what the skin feels like, or if your sleeve seems, the sleeve of your clothing seems to be fitting different, pay attention to that. Don't get panicky. Don't get all worked up about it, but just monitor that. Take a day off in between. Make sure that it settles back down again. And that's a good indicator that probably you've done a little bit too much, and just take a step backwards. Doesn't mean that you're developing lymphedema. It just means that you want to be mindful of protecting that side a little bit. In the event that you do have lymphedema, you should probably always use a compression garment during an exercise routine on that side. That's something that I recommend to people. It is recommended by the National Lymphedema Network, and it's very important to use that external support to help prevent, again, additional fluid from accumulating in there. And last, but maybe not least, speaking as a trained professional, if you don't feel comfortable and confident and you really don't know where to start, seek out one of us who has some experience as to how to progress you. The Live Strong program at the Y is a great program. There are several therapists in Western New York that have been trained in some kind of cancer rehabilitation. Amy is probably a great resource for you as well, to be able to recognize certain things that you can utilize. So don't ever hesitate to ask your doctor, listen, I want to exercise, I'm afraid. They chances are going to say, well, just go out and do whatever you do. Ask them for a specific recommendation of somebody, because chances are they do know somebody. So now I just want to step you through some very basic exercises. This is just predominantly for your upper extremity or extremities, just so you can see how simple it can be. Things of this nature can be very, very beneficial, and they're very basic, very simple exercises. A good place for you all to start if you haven't ever done anything. So the first one is a ball squeeze, and that's just what it sounds like. You get a tennis ball or a Nerf ball or a ball of socks wadded up, anything that you can get in your hand, and just squeeze gently and hold for a nice low count to 5 and then relax it. And again, these are the strength exercises. So we want you to do about 8 to 12 repetitions of each exercise. So very simple, very basic, but really great pumping activity for your whole arm and getting those muscles moving. The next one is an elbow flexion. That's exactly what it sounds like and what the picture looks like. You can get yourself a little dumbbell. You can use a hammer. You can get a bottle of shampoo. Don't go out and buy a whole bunch of weights. You can just use something in your house that weighs a pound, maybe 2 pounds, and just bend and straighten that elbow very slowly, very controlled, very specifically, and intentionally working on that full range of motion. Can be done sitting, can be done standing, can be done laying down. A good starting point to get your bicep working. This is elbow extension, and this is the opposite direction, where you're starting from a bent elbow position and you're straightening it. This illustration shows the lady laying down. So she's got her upper arm at a 90-degree angle to her torso, and she's moving from her face, straightening the arm, but this part of her arm is staying static. So her whole arm isn't going up and down. It's just from the elbow to the hand that's coming up, pointing to the ceiling, and then going back down again. Again, this could also be done in a standing position, but you want this part of your arm overhead in that circumstance, because otherwise you're working with gravity and not against gravity, and it's not quite as beneficial. So it's advised that you do it in a laying down position. Again, she's holding a little bit of a dumbbell. Can be done very simply with something very small weighted at home. This is a fancy word for bringing your arms together. So horizontal adduction means that she's starting in this position. She's bringing both hands up here. It would end up in front of her chest and then slowly extending back out, starting with the upper arm at a 90-degree angle to the torso again. So the arm comes up, the hands meet, and the arms come back down again, holding a dumbbell or a little weight in both hands. Shoulder flexion. This shows the lady doing it in a standing position, but also could be done in a lying down position. So flexion is with your arm extended. You start here at the hip, you're bringing it up and overhead like she is. And if you can get it further up, even better. And then you slowly just let it come down to the side again. Also, again, holding a dumbbell, not just isolating it to the involved side, but certainly including both arms in this one. You can do this one arm at a time, or you can do it both at the same time up and overhead. Shoulder abduction. This is a different direction than the adduction. So in a standing position, starting at the hips, you're bringing your arms up sideways and overhead. So it's out to the side, not forward. If you think back on this one, this one, her arms came forward. And this one is arms coming up sideways and then back down to the outside of her body. And finally, pole walking. Now, this is a great exercise because you get both the cardiovascular component as well as the upper extremity strengthening component. There are poles that are sold specifically for walking at Dick's, and probably Walmart and Target may carry them. You certainly could find them on Amazon. What you do as you're walking, you're digging that pole into the ground in front of the foot behind it, and you're just alternating and using the pole as a means of helping to propel yourself, but it's more so to help strengthen the upper body. Don't have to have poles to have the benefit of a walk. Get out there and just walk. But if you can incorporate that, again, you'll get both a combination of strengthening as well as aerobic conditioning. So that good brisk walk is going to be beneficial for you. And that's all I have for you tonight. I'm happy to entertain any questions you may have, and more than happy to help you in any way I can. If you have information that you need to try to get squared away, let me see if I can hand this back over to Amy. There we go. And then she can take charge.
All right. Let's see. Oh, I am the host now. All right. That's fancy. Okay. Thank you so much, Donna. That was awesome information. And it just, I'm so honored to have you here and to have that shared, because I love the fact that it was easy to understand. Something like lymphedema can be very complex, and you do a great job of really making it simple to understand given its complexities. And you know what's great about those exercises, they're really things we all do every day without even thinking about it, right? So like Donna said, a bottle of shampoo, a can of soup, you know, the hardest part sometimes is not dropping it on your face if you're lying on your back. I've done that before. Be careful. You know, just finding little ways to work these things into your day can make a big difference. So if there are any questions, this is a great time to please go ahead and drop them in the chat, and we'll give everybody a couple of minutes just to see what might come up. And I'll give, if it's okay, Donna, I'll give a quick, while people are doing that, I'll give a quick little bit of a difference between what Donna does and what I do. So Donna is a physical therapist. She's a doctor of physical therapy, and she is a certified lymphatic therapist. So I am a licensed massage therapist by New York State. And then I also have additional training around oncology massage. So I work with people who've had a cancer, either a cancer diagnosis or in treatment or a cancer history. And I modify massage therapy to make it safe and effective for people with cancer history. And I am certified in manual lymphatic drainage. So the difference between us is that I work specifically with the hands-on technique that is used to help facilitate the movement of fluid when you're experiencing lymphedema or working to help reduce the risk. Donna has taken that, Donna's work takes that a step further. So she does things like compression garment fitting, wrapping if needed. So there's different levels to lymphatic support. And someone like me is wonderful to help you if you have a risk of lymphedema but have never experienced it, or maybe you're dealing with, you know, mild symptoms and just need a little bit of help managing them, or you're already working with someone like Donna because maybe you have ongoing concerns around lymphedema. You know, you have someone who's fitted you for a sleeve or compression pump. You know, she takes care of the wrapping when needed, and I can be there to support you in between for things like lymphatic drainage. So that's the difference. If you see someone who says they are a manual lymphatic drainage therapist versus a certified lymphatic therapist, there's just the certified lymphatic therapist can also even do things like wound care. It's just a more complete treatment cycle. And a lot of the time, the work that Donna does is hopefully going to be covered under insurance. Whereas someone like myself, who's in private practice, you know, for massage therapy, even though I do the same technique that she does for part of her work, most of the time, unfortunately, I'm self-pay that, you know, insurance doesn't cover it. So those are a couple of little differences. And if you are looking for someone in your area and you're not sure who would be most beneficial to you, please reach out to either Donna or I, and we can help you find someone. Okay, let us see. I think there's a couple questions. So the first one is, I recently rejoined Silver Sneakers Yoga at the YMCA. Is that a good way to get these exercises done? I know my answer, but Donna, I'm going to let you go ahead and chime in on this one.
Absolutely.
Yeah.
Silver Sneakers generally is a very, I'm usually going to use the word easy program. So it's not strenuous typically. Their yoga program is also fantastic. It's going to be a lot of basic stretching and stability exercises, which also lead to strengthening. One of the beautiful things about yoga is that it is all encompassing in terms of strength, stability, flexibility, mobility, balance, coordination. About the only thing that you're going to lack from that, and again, depending on the level of yoga, and Silver Sneakers is likely not going to be the level that you would incorporate, you would get the cardiovascular component. So you'd still want to be out there again, taking that walk, doing some biking, doing a little swimming, any of those kind of things. But certainly the strength and flexibility end of things is very, very benefited by that yoga program.
Yeah. And I'd like to add in that I actually myself have done the Silver Sneakers cardio and weight programs at the downtown Y. I actually did it with my mom, and you know what? I'm only 4 years out from my diagnosis and treatment, and they were very lovely to me. No one gave me a hard time for being maybe a little bit younger than some of the other participants. But I found it to be a really good workout. So, you know, I'm a big fan of yoga, but if you are looking for that cardio aspect, the regular Silver Sneaker programs are awesome. And generally what's wonderful about them too is that you can really modify the intensity. You can always make modifications for the amount of weight that you're comfortable with. So yeah, all of those types of programs are going to be really good for movement. So the next question is, how soon does lymphedema develop after a surgery?
Excellent question. The vast majority of people who are going to develop lymphedema usually occurs within the 3-year window from surgery to onset of lymphedema. So if you're past 3 years, your risk level has certainly declined, but you are at risk for a lifetime. So be mindful of that. But chances are, if you've cleared that 3-year hurdle, and some people would extend that to 5 years, but most of us are looking at a 3-year window of time as to when you're most susceptible.
Yeah. Yeah, and I definitely support that. You know, the one thing that I do advise my clients on and talk about is that we have a lot of great statistical information. Like Donna was saying, we've come a long way with understanding more about lymphedema, but it's still a relatively, lymphatics in general are still a relatively young area of study within Western medicine. And anecdotally, I'm sure Donna can tell you, and I certainly can too, that lymphedema doesn't always play by the rules. So even though we know these statistics and we know these things, it is important to keep it somewhere, you know, if not top of mind, in the back of your head, so that you can make informed decisions and do what's in your best interest. Is lymphedema only affected on the cancer side?
General rule of thumb, yes. And typically only the extremity that's involved. So again, in the case of a right breast cancer diagnosis, it would typically only affect the right upper extremity, maybe the side of the neck, maybe into the trunk, but typically that's where it's going to be isolated to. In the event that maybe you had sentinel node biopsies on both sides for whatever reason, then the potential is there for both sides to be involved. But again, the higher risk level would be the side that there was an actual cancer diagnosis in. So I can't say 100% of the time that it doesn't ever occur anywhere else other than the involved side, but I would hazard a guess probably 99.9% of the time it's just the involved side. and that
Yeah,
extremity. In other words, so if you've got involvement in your arm, it's not going to show up in your leg as a result of having had it in the arm.
right. Yeah, exactly. Typically, I would actually say, and I think especially in the case of breast cancer, that it's less, you really have to have that mechanical insufficiency. You have to have that change to your lymphatic system that is generally caused by lymph node removal and or radiation. With lower extremities, so dealing with the legs, sometimes it can be a little bit more complex, because if someone has something like say they have, ovarian cancer or uterine cancer, where they've ended up having a lot of lymph nodes removed in the pelvis. Well, the way the system works, it could affect both legs, even though maybe it wasn't even in the legs, if that makes sense. But with breast cancer, it's generally going to be on the side that was treated in some way. Let's see. Can you, and this actually is a great follow-on question to that. Can you comment on lymphedema in the breast from radiation treatment and problems getting an accurate diagnosis?
Oh, certainly. Wow, could you give me some more information about specifically what you're, in terms of problems getting an accurate diagnosis? I guess I need more information to be able to really comment on that. Certainly you can have lymphedema if you do have breast tissue that's remaining in the event they did a lumpectomy and not a mastectomy. Certainly there could be lymphedema in the breast tissue itself if you've had radiation, because the radiation does scar some of the remaining lymph system. But in terms of getting an accurate diagnosis, your breast surgeon should be able to assess that. If you're not certain, Amy or myself, we certainly could take a look. The diagnostic tests, again, typically are not really done. It's mostly a subjective history, onset type of thing. The diagnostic tests that are there basically only confirm if there's fluid being built up. So that also can be seen a lot, just again, subjectively, and measurement taking, and what the history of the treatment and diagnosis was. I don't know if that answers the question good enough. I'm sorry for kind of fumbling through that.
No, I think that's great, Donna. Mary, if you feel the need to offer more direction, if you didn't get your answer, I will add on that I think, sometimes I think there can be things around early, like with early stage lymphedema. Sometimes they're not always extremely visible symptoms. Like it may not be that even the limb or the breast or the side body, the trunk, like swells up extremely large. It can be things like aching, feelings of heaviness, just it can be some tingling in the fingers. There's different things that can cause it. And I know that sometimes I think in the area of the breast, especially, it's probably, my guess is it might be a little bit more of ruling out other things, like checking against things like mastitis or cellulitis or anything, that might cause swelling in the breast, like an infection or like, something like that. And if they would rule that out, then likely it could be, if it's truly just, the swelling, then or those other symptoms, it could be lymphedema in the breast. But it certainly is possible. I've worked with people who've had that before. And I do want to state, we've mentioned a couple times about coming to Donna and I. For anyone who is a patient at Roswell, there are 2 lymphatic therapists in the rehab center at Roswell, Carly and Natalie. They're great. And they're both CLTs like Donna, so they can do what they call full decongestive therapy. So if you ever have a question and you don't feel like you're getting an answer from your doctor, I would definitely recommend asking for a referral to the lymphatic therapists at Roswell as a good starting point, because they also could help you maybe get answers if you feel like you're not getting the answers you need.
Right.
Okay.
Agreed. 100%. Yep.
Yeah. And I'm trying to watch our time, but we have a couple more questions. So I think we're still good. We're under an hour. So that's great. Let's see. Would Tai Chi be helpful?
Absolutely.
Yeah.
Again, right in that same realm of yoga. Great for flexibility, stability, strength, balance, coordination, overall conditioning. Absolutely. It's a great form of exercise.
Yes, absolutely. I second that. Okay, we've got we've got a question. I have breast lymphedema. Am I still at risk in my arm? Also had one lymph node removed.
Again, anytime a lymph node has been removed, you are at risk. So even though it seems to be showing up in the breast, some of it would depend on what are we talking about timeline, in terms of when was your surgery, has the breast lymphedema been treated? Certainly could be treated, but yes, you're still at risk in your extremity in your arm because there has been an insult to your lymphatic system.
All right. We've got another question. My venous doctor has talked with me about a pump to help with lymphedema in my left leg. Would I need a prescription from him or from my primary doctor to get one? And where do I get one? Is it possibly covered by insurance?
You definitely would need a prescription for it to be covered by your insurance. So you could get that from your primary doctor or the venous doctor if he's the one that actually talked to you about it. I'm surprised he didn't give you a prescription for it. And that can be gotten through Sheridan Surgical. That's probably your best bet. They can hook you up with the peeps that they have. There's also oh gosh, Tactile Medical has a big presence in Western New York. They are really, really good about doing all the legwork for you. You may or may not have insurance that covers it. Typically, there's a percentage of a pump that they will pay for, 50% or more. But there's a lot of documentation that goes along with that. But yes, you would definitely need a prescription for it.
Okay, great. And Mary did follow up on her question about the breast lymphedema and the diagnosis. She was told that it was seroma swelling, and she is getting treated at the lymphedema clinic at Roswell.
Okay. Yeah, that makes a lot of sense. Seromas are very common, especially if you've had a lumpectomy, and that usually will resolve with proper treatment. So that's good that you're getting it addressed.
And then we've got one more. My first mastectomy was in 1992, so lots of lymph nodes were dissected. My second was in 2004, so just a sentinel node. I occasionally have trouble on my left side with a muscle that torques. I just finished 12 weeks of PT where I was doing 30 reps and where the weights I lifted went up considerably. I want to maintain what I've done, but worry about adding weight. Is keeping the same weight okay, or should I aim to continue to add weight?
Again, as long as you're progressing, there's no indication through that recent research that says that there's any upper limit. What I usually suggest to people is if they feel like they're straining to complete those 8 to 12 repetitions, that's too much weight. You should be able to get through those 8 to 12 repetitions at any weight that you've progressed up to comfortably. So let's say you complete 12 repetitions, you've done those 12 repetitions and you're kind of glad you don't have to do a 13th. But if the thought of doing a 13th makes it feel like your arm's going to fall off, that's way too much resistance. So if you can do a bicep curl with a 50-pound dumbbell and you've started at 5 pounds and worked your way up to 50 pounds, there's nothing to stop you from going to 55, but you need to go 50, 51, 52. So by all means, progress if you feel comfortable doing it. Just don't feel like you're straining to get there.
Yeah, I think I really want to touch on what Donna said earlier too, about like listening to your body, really checking in with yourself. How is that feeling? Every time if you are doing a new activity or a repetitive activity, doesn't mean you shouldn't do it, but pay attention, but you might need to take more breaks than you would have prior to your cancer experience, or you might need to change up the movement a little bit, but really checking in, paying attention to the things you're feeling and experiencing can help make sure that you're not overdoing something. I mean, I know there are women in the breast cancer community who are out there doing CrossFit after they're, when they're really just kind of coming back from everything. And the key is, it's not so much about that there is some cap that you can't ever go beyond this. It's about what's right for you and your body and what you know to be true for your body, right? It's really about easing into it and gradually working up to things, not overdoing it too quickly. That's probably one of the key takeaways.
Absolutely.
All right. Do we have any final questions? Anything that anyone wants to ask before we start to wrap up?
There's one question, it looks like, about will the slideshow be available?
Yeah, sorry, I missed that one in between a couple of things. Yes, will a slideshow be available so we can review the exercises? Donna, I'm not sure about that. Will the slideshow be available?
Will it come through in the video, I would assume?
It should. Yeah, you're right. It should. Yes. Yeah, because we'll be sharing the video on our new YouTube channel, which I'll get the details on, and I'm sure we'll send something out about. Yes, because the way that Donna presented this, and she shared her screen as you're watching it. I don't know that we have the slideshow to send out separately as a PDF, but you went through the recording, you will be able to watch, go back and rewatch. And of course, the great thing about a recording is you can actually pause and take notes and, pay a little bit closer attention to specific slides. So hopefully that's helpful.
Yeah, and I'm more than happy to send out the slides to you if you can disseminate them, and I could just send the exercise slides, and if you can send them on to whoever was in attendance.
Sure. Yeah, we can talk to Rob about that and find out a way to share that. I believe that I imagine we have the ability to share specifically with the people who've registered for this event, and so we could send it out as an attachment to them. Well, I think that's everything. We've got some thank yous. Thank you for the great information. Thank you for another great session and great information. This was great information and very reassuring. Mary, thanks. Wish I knew this 2 years ago. I know. I'm sure Donna feels this way, that it's one of my greatest frustrations in this space is that no woman should ever end up with lymphedema not knowing it could happen to her. And, we've come a long way. We've come a really long way. But my hope is that someday the standard of care is that every woman who gets a breast cancer diagnosis, as part of her treatment, is that she gets sent for at least a baseline consultation with someone like Donna, with or the Roswell Clinic, that every woman has the opportunity to understand her risk and then be able to start to make informed decisions around it. So to those of you who've experienced this, I wish that it was different, but I am glad to say that there are people in our local community who are serving and helping with this. And the cool thing too, that, the one good thing is that because it's a young area of study, there's a lot happening all the time. I mean, there's so much new information. They're finding new ways to work with therapies, things like kinesiotaping. They're even starting to look at surgical options for extreme cases. There's research and there's advancements that are occurring in the space. So hopefully in the future, other women won't have to go through quite as much as as some of you have. So
I'll just tag on to that thought process too, Amy, that breast cancer is the most researched form of cancer that there is. So even though it's an odd thing to say, if you have to have a cancer diagnosis, there's so much more information about breast cancer than there are other forms of cancer. If you have to have a cancer diagnosis, that's something that you're going to benefit from all the research that's being done.
Yeah. Yeah. I think those of us in the cancer community know that it's not really, we don't really love to hear that there's like, oh, you got the good cancer, because I don't think there is any good cancer, but I do appreciate what Donna is saying, that, you know, one of the upsides to the sad fact that breast cancer is the most commonly diagnosed cancer among women, is that there is a lot of research, and thanks to, you know, many of the big organizations out there over the years and the efforts that we are heavily funded and heavily researched, and we've come a long way. And of course, we still have a really, really long way to go.
Amen.
So yeah, thank you to all. Katherine shared that she had to fight to get PT in 1992. And then the surgeon saw what happened as a result and started prescribing it to all her patients. So yeah. And these are things too that, you know, it's never too late to make a change. So, you know, if you still go see your oncologist as a follow-up, tell them, you know, especially if you're dealing with lymphedema, tell them what your experience was. Tell them that it would have been helpful if you had known that there was a risk, or tell them that you learned that there are people in our local community who are doing work with lymphedema management and risk reduction. And maybe if, you know, we all say it enough, right? Some of it'll stick in there and they'll start to go, maybe that's something that would benefit my other patients too. So, all right. So I think we're right about an hour, and I think the messages have stopped coming in. So I'm going to go ahead and stop recording. So I